Do you know, in India, cervical cancer contributes to 6 to 29% of all cancers in women, and it's increasing on and on. Hi, I'm Richa Sehra, Editor-in-chief, ResponsibleHospital.com. And today I have a very special guest, Dr. Deepika Agrawal. She is a senior gynecologist, obstetrician, and also a colposcopist. And she has immense experience from London and India with 20 years of practice here. And today we're going to discuss about cervical cancer screening, which is a basic and big concern these days. And let's discuss about it, Dr. Deepika. A very warm welcome to you.
Thank you, Richa, for having me here. I think after having worked in India and in London for so many years, and finally moving back to my country where I belong to, it is my aim to bring the best quality healthcare to the women out here. And also being a colposcopist from London, I'm very passionate and actually obsessed about the work that I do to increase the awareness about cervical cancer screening. So it's a pleasure to be here and to talk about cervical cancer screening today.
Alright, so we'll start with a set of questions, Dr. Deepika, and my first question to you is that since you have experienced this thing in India and also in London, so have you ever observed any different opinion towards the approach of healthcare between the audience of UK, London and India?
Yes, I mean I worked in London for nearly 15 years and I've been in India for the last 2 years. What I felt was, or what I feel is that women are getting more aware here, but yet there is a lot to be done in India. I suspect clearly one of the reasons is that in London there is a cervical cancer screening program, so women get automatic recalls from the hospital if they are not turning up for their cervical smears. In India we are yet to do that. I think one of my aims here is to spread awareness as much as possible, either like what we are doing today, or when I'm seeing the patients in my clinic, or by doing different events. Because this is one of the cancer which, if timely screening all the women are doing, we can detect it, we can treat it, and we can fully prevent it.
That's really commendable, I think. So do you think there are some measurements which are ready, and there are some things which can be done even at the initial stage of cervical cancer?
So yes, the cervical cancer screening usually should start by the age of 25, and women should be coming every 3 years for these tests. As the name suggests, it is a screening test, which means it screens the women who are at high risk of developing this cancer. So there are tests like pap smear. Pap smear is a very, very common term which is used. It is a tiny little brush that we use, and we take some cells from the neck of the womb, which is also called as cervix. It is done in OBD in the clinics by the gynecologist, and usually we get results in 5 days time. We would see either precancerous cells or early cancer cells, which is fully treatable by different modes of treatment.
Alright. And how frequently do you think that pap smear should be done with each woman?
So the guidelines that we have in London, which is also called as NICE guidelines, it advises women, or it recommends women to attend for screening every 3 yearly from the age of 25 until the age of 55 years.
And it is quite curable, do you think?
Yes, if we are detecting the cells at the precancerous stage, which it is designed to do, we can fully treat it.
Alright, so all the solutions are available in India also, do you think that?
Absolutely, absolutely. I think all the big hospitals would have instruments to carry out these procedures. This is one of a very common lab test which most of the labs are able to do it, and the treatment is done if need be by a simple instrument called as colposcope, which means camera examination of the cervix, and we can always, if need be, take biopsy, or we can remove those abnormal cells from the cervix.
Alright. So doctor, one question which is just coming to my mind, that since you have very good experience in London, and so what made you to come in India and do your practice?
Well, I think I was born and brought up here. I spent 30 years, and after spending a lot of years in London, I thought I should move back to my country and bring back my experience, and bring that standard of care to all the women over here, and make sure that they get all the standards which we are able to do in London.
That's such an amazing thing. Okay, so another question which is just coming to my mind, and I think a lot of women would have this question, that what is the difference between the gynecologist and obstetrician, because a lot of people are not able to understand the basic difference of it. If you can just elaborate here.
So gynecologist and obstetrician, the basic differences: obstetrician deals with the woman when they are having babies, when they are pregnant. So that is an obstetrician about, and gynecologist deals with any other aspects of woman problem, which is mainly related to either the uterus, which means the womb, or the ovaries. And of course, there is another term which is colposcopist, which not many people are aware. And I'm also certified colposcopist from London. These are the specialists or super specialists who are specifically trained to do all these pap smear and treat them.
Awesome, awesome. And what are the kind of risk factors which are involved with cervical cancer?
So the main risk factors, or as we can say, the high risk women who can end up having cervical cancer, is if somebody is smoking, if someone has multiple sexual partners, or they are immune suppressed. When I say immune suppressed, that would mean if someone has things like HIV or hepatitis B or hepatitis C, which has actually reduced her or suppressed her immune system in the body. Now, having said that, someone who's smoking or has multiple sexual partners doesn't necessarily mean that they would end up with cancer. It just means they are at high risk, and those are the ones who should definitely see their gynecologist 3 yearly to make sure they are not developing any sinister cells in the body.
Alright. So is there any cervical cancer vaccine which is available in the market?
We do have cervical cancer vaccine. There are 2 types right now available. And they both help in preventing cancer. Now, what I want to inform here is that they do not prevent 100%, they are largely effective, and women who are taking it should still be going for their pap smear screening from the age of 25. We recommend, or we advise, to give this vaccine to young girls from age of 10 to 12 years. The reason is that cervical cancer is largely associated with a virus called as HPV, human papilloma virus. Now, this virus only comes with sexual activity. So ideally, it should be given before the sexual debut starts in young girls. We can give catch-up vaccination till 30 to 35 years. However, I would inform the women that the effectivity may be low. So yes, and usually there are 3 doses of these vaccines to be given straight away after 1 month or after 2 months, depending on the type of vaccine, and at 6 months.
Alright. So what are the tests available for cervical cancer screening, doctor?
So largely I think when we talk about the test, it is the sensitivity of the test that is most important. What generically everybody knows is pap smear. Pap smear, the sensitivity is not that great. In the same way we do what we call as LBC, liquid based cytology. The procedure is the same. There is a little brush. We take the cells from the cervix and we get the results. Also, now we have started doing what we call as HPV, as I previously mentioned, because HPV virus is associated with most of it. So women can also ask their gynecologist if they specifically want the pathologist to look for HPV, and we can combine LBC, which is liquid weight cytology, with HPV as well.
Alright. And how frequently one should repeat the test?
It should be 3 years.
It should be 3 years.
As long as they are coming normal.
Alright. I think that was such a valuable discussion which we had, doctor, and I would be very thankful to you for your valuable time. It was such a great interaction. I think it's going to really help a lot of women and a lot of girls to get those internal insights. So my regards to you and all the best, doctor, and let's meet again sooner. Thank you so much.
Thank you, Richa. Thank you very much.